Measles is a disease which is caused by the virus rubiola. The disease is also called as rubiola, and the virus belongs to the genus morbillovirus. Coming to the introduction part, this disease is known to be an ancient disease where there was no clear distinction that was made between measles and the other exanthematous diseases. That is, the diseases which are caused due to the skin eruptions, including the smallpox. And it was only in 1629 that this disease came to be known as a separate entity, and it was Thomas Indelham in 1690 who gave us a clear and accurate description of the measles in English literature or English language. This disease caused an epidemic in a Faroe Island, and the causation of this disease was studied in detail by a Danish medical student called Peter Panum, who gave who established the scientific knowledge about the disease, that is a measles. And it was Goldberger and Anderson in 1911 who gave us the concept of the viral origin of this particular disease, and they were successfully able to transmit this disease to the monkeys with the infectious blood of the patient as well as the other nasal secretions. And the isolation of this virus was in the artificial media or in the cell culture was usually carried out by Enderant peoples, who isolated the organism in monkey kidney or human kidney cells. Coming to the measles virus, the morphology of the measles virus, it usually has a structure similar to that of the paramyxovirus. It is roughly spherical in nature, and sometimes it can be pleomorphic in nature. And the size of this organism is 122 to 50 nanometers. It has a helical, it is a tightly packed helical nucleocapsid which is surrounded by a lipoproteinaceous envelope, which expresses hemagglutinin spikes along with the F protein, that is a fusible protein that helps in agglutinating the RBCs. There can be no illusion that can be made with this virus because they do not show neuraminidase activity. Whereas in other viruses where you can see that both hemagglutinin and neuraminidase activity is seen, and with the help of neuraminidase activity we can elude the virus. But here in the case of this measles virus, it is the virus which expresses only the hemagglutinin spikes, whereas the neuraminidase spikes are usually absent, and hence no illusion can be made. Now coming to the growth of this organism, how can we isolate the organism in the cell culture? Mostly the preferred choice for the primary isolation of this organism is human kidney or the monkey kidneys, or you can go with the human amnion cell culture techniques for the primary isolation of the virus. And in order to adapt the virus in the cell culture, you can go with the continuous cell lines such as HeLa cells or the Vero cell lines. And this organism can also be very well grown in amniotic sac of the hen's egg, and the cytopathic effect is the formation of multinucleate syncytium formation which contains acidophilic nuclear and cytoplasmic inclusion bodies or the cytoplasmic granules. And the most important characteristic feature of this organism is that it produces multinucleate giant cells called as Warthin-Finkelday cells, which can be seen in the lymphoid tissue of the patients. This organism is highly labile in nature, getting inactivated at a room temperature and exposure to the chemicals such as ether, chloroforms, etc. And it can be stabilized by mixing it with molar magnesium sulfate so that it can resist heating at a little higher temperature. Now coming to the clinical features of this disease, the incubation period, that is the time of exposure of the person to the virus, and the appearance of the first clinical symptom is the incubation period that usually lasts for 9 to 11 days, and it begins with prodromal malaise, fever, conjunctival, so you have infections, cough and nasal discharge, and this prodromal illness usually subsides within 3 to 4 days after the appearance of the rash. And the most important characteristic feature of this disease is the appearance of the Koplik spot in the buccal mucosa. Sometimes you can see that in the conjunctiva as well as in the intestinal mucosa. And next important characteristic feature is the appearance of the red maculopapular rash that first appears on the forehead, which descends downwards and can disappear or can usually they disappear leaving behind a brownish discoloration and finely granular desquamation. So these are the characteristic features of the disease that is the measles. Most of the children usually recover, but sometimes some of the children can land up to the complication due to the viral infections such as croups or the bronchitis, or due to secondary bacterial infections that is pneumonia or the otitis media. And rare complication of giant cell pneumonia can be seen in this particular disease only to the children who are immunodeficient or who have a poor malnutrition, and this type of complications are mostly seen in the developing countries. Next complication or the rare complication associated with measles is a meningoencephalitis, which usually recovers with a neurological sequel. And the late complication associated with the measles is subacute sclerosing panencephalitis. It also causes proctate enteritis in the children who are living in a poor nation, making it associated with measles enteritis. Next important thing about this organism is it suppresses the delayed type of hypersensitivity reaction. Now this delayed type of hypersensitivity reaction is mostly used to identify the tuberculosis infection. So in the case of measles infection, there is a delayed type of hypersensitivity reaction that is usually suppressed, due to which we do not get a positive report of Montax or the allergic test, and hence makes the underlying tuberculosis more worse, and we will not be able to identify the tuberculosis infection when there is an attack of the measles infection. And apart from that, it also exaggerates, or after the attack of measles, it also exaggerates an allergic eczema, asthma, and Hodgkin's or lymphoid nephrosis. And in the pregnant woman, if the pregnant woman is attacked by measles, it induces labors resulting in sudden abortion or premature delivery. The organism has the ability to cross the placenta and attack the fetus, but there have been no evidence of teratogeny, that is the malformation that is usually caused in the fetus. And the organism also has the ability to cause thrombocytopenia leading to purpura, which ultimately leads to the bleeding in the mouth and the other respiratory areas. Coming to the pathogenesis, or the pathway by which the organism usually enters the body and causes the infection, it is via the aerosols or the close contact with the infected person. The organism will have the ability to enter into the respiratory tract, or it can enter via the conjunctiva too. And once it gains an entry, it usually moves down and replicates locally or in the adjoining lymph nodes. So when they replicate, there is a primary viremia where the organisms are carried to the reticuloendothelial cells, after which there is a secondary viremia which carries the viruses to the epithelial surfaces such as skin, the conjunctiva, or the other secretory areas, where you can see the excretion of this organism. The pathognomic feature or the characteristic feature of this disease is the appearance of the Koplik spot. This Koplik spot is usually small. It is bluish white ulceration that can be seen in the buccal mucosa opposite of the lower molar, and it is characterized that you can identify this Koplik spot containing giant cells, cytoplasmic and nuclear inclusion, along with the virion components which are actively replicating. This virion particle can also be seen in the vascular endothelial cells near the skin rashes, and the skin rash is an immune reaction that is taking place between the T lymphocyte and the cells, which are where you can see the actively replicating virus particles. The prodromal phase is between 2 to 4 days, during which you can isolate the virus from the nasal secretion, blood, urine, etc. The isolation of the virus can also be done from the urine after 2 to 4 days, or within a week you can isolate the virus. But between the 2 to 4 days you can isolate the virus from the nose or the excretory component of the human being. Next, coming to the lab diagnosis, for typical case there is no need for the lab diagnosis, but for atypical cases, as well as to distinguish between the rubella infection, you need to go for the lab diagnosis, or you can say the lab diagnosis is very useful for atypical cases and for differentiating between the rubella infection. Cytopathic effect, or before going on with that, you can isolate the, you can see the multinucleate Jan cells in the nasal secretion even before the prodromal illness that is usually identified in this particular disease. You can identify the organism in the nasal secretion in the form of multinucleate Jan cell, which can be identified with the help of JMJ staining. And most of the antigenic character of these organisms are detected by immunofluorescence. For the isolation of the virus, for the primary isolation, you can go for monkey kidney cells or the human kidney cells. And the cytopathic effect, as we all know, is the formation of a cincture which takes a week or later. So before the cytopathic effect can be identified, you can directly go for the early diagnosis with the immunofluorescence. Coming to the serological diagnosis, it is identifying the antibodies. As we all know, whenever there is an antigen, that is a virus enters, immediately in order to respond to that, our body produces the neutralizing antibodies. So it is not only called as antibodies, but they are called as neutralizing antibodies. So you can go for identification of neutralizing antibodies, hemagglutinin antibodies, and complement fixation antibodies. So identifying any of the three antibodies helps us to know the recent infection with the measles. For the identification, you can go for the fourfold rise of the antibodies during the acute phase or after 10 to 21 days after the appearance of the rash. You can go also with the measles specific IgM antibodies that is usually detected between 1 to 2 weeks after the appearance of the rash. And false negative reports have to be given 1 week before the appearance of the rash and after 1 week after the appearance of the rash. So the type specific IgM antibodies that are identified between 1 to 2 weeks of the appearance of the rash is only a characteristic feature where you can identify the diseases. Next, for the identification of measles specific antibodies from the cerebrospinal fluid helps in indicating the SSPE, that is subsclerosing panencephalitis. Coming to the epidemiology of this disease, is mostly an endemic disease causing an epidemics in the children between 2 to 3 years old, and the period during which you can see a high rate of this measles infection is in the late winter, and the peak of infectivity is in the month of April. Children who are 1 to 5 years old are more prone to this type of infection, and the infection cannot be seen within 6 months of the 6 months of the baby or the child who is born, because he is protected with the maternal antibody. That is the natural passive immunization with the mother's antibodies. Once attacked, this disease usually gives a solid immunity lasting for the whole life, and the natural host of this disease is only the human. There is no reservoir host, or there are no carriers, asymptomatic carriers. So the person who is infectious is able to transmit the infection, and this infection, as it is a natural host, is only the person, but we can transmit the infection even to the monkeys by injection into intraperitoneal or subcutaneous injection of the virus. Next is the onset of the symptom is, as we know, it is a 2 to 4 days after the infection or the prodromal malaise. The person becomes infectious immediately after he is attacked by the virus, and the onset of the he is infectious till the onset of the symptoms, till the rash usually subsides or desquamates. And it is during the prodromal phase that the person is highly infective in nature, causing infection or spreading infection to different peoples. And the spread of the infection is by a direct contact or inhalation of the aerosols which contains or the droplets which contains the virus particles. Once the virus gains an entry through the respiratory tract or the conjunctiva, it is able to land up to the clinical diseases, mostly in case of non-immune individuals. Now coming to the remote island, as already discussed, there is an island called as a Foray Island, which had shown an epidemic of this particular infection, causing infection to about 75% of the individuals. So it becomes epidemic in nature once it causes the infection in close community areas. Coming to the prophylaxis or the controls, normal human gamma globulin giving within 6 weeks or the 6 days of the exposure of this infection can protect the person from the further complications that are caused by the virus, and it is mostly valuable in the children who are immunodeficient, pregnant ladies, and the other who are at high risk of getting infected with this particular virus. And the prophylaxis can be given with the help of live attenuated virus strain called as Edmonton strain. Now there was certain like complication associated with it, which is called as a febrile rash, also called as a vaccination measles, because it was not completely attenuated, and hence further attenuation has to be carried out to make it attenuated and used as vaccine. Now because there are certain risks involved with it, Edmonton strain has limited use in the prophylactic treatment of this particular disease. So you can go with the Schwartz-Moraton strain that provides immunity to the children who are 15 months and above. But in the countries like India, where tropics, the children are who are below 12 months are usually infected with the virus. So in that case, you can go for a vaccine which is prepared called as Edmonton Zagreb strain, which have been attenuated in a human diploid cell lines. So this strain is mostly used in the tropics to prevent the infection from the measles. It also have the ability to show the seroconversion in the children who are 4 to 6 months old. Coming to this particular vaccination, it is mostly given in the developing countries to the children who are 9 months of age, and in the advanced countries where the children of 15 months and above. It can be given a single subcutaneous injection, or it can be given in the combination of MMR vaccine, that is measles, mumps and rubella vaccines. And a single dose of subcutaneous injection helps to provide infection beginning from the day 12 to about 20 years. Contraindication over here are the person who have underlying tuberculosis, pregnant women and immunodeficient patient cannot be given with this vaccination. And recently a live attenuated vaccine which can be given in an intranasal aerosol has been developed, which provides protection to the children who are 6 months of age also. That is as we told you, till the 6 months of age, it is a maternal antibodies who protects the children from the infection. But with the help of this vaccination can be also given to the children who are from the 6 months of age or below 6 months of age. It gives protection to the children for the lifelong immunity. And with the help of this immunization, most of this measles infection have been eradicated, and steps are taken to completely immunize the children and eliminate the measles infection, and many reports have come forward to show a positive sign in the USA. So this is about measles virus and the disease measles.